You're watching Heart to Heart on ABC 27, sponsored by Penn State Health.
Welcome back. Joining us now is Tim Anger and your doctor, right? Dr. Abdul Elnagar, cardiac surgeon at Penn State Health Heart and Vascular Institute. Tim, you're going to share your story with us. What was your situation?
Well, I'm a principal at a Christian school up in Emmaus, which is in the Lehigh Valley. And I had been down in Hummelstown on January the 18th for a board meeting of the Keystone Christian Education Association. And all of a sudden I went unconscious and fell on the floor. And the people around me thought I was having a stroke, so they called 911 and had an ambulance come and take me to the nearest hospital, which happened to be Hershey Medical Center. And as soon as I got there, they did a CT scan, and then they called in Dr. Elnagar to read the scan. And he can probably take it from there.
Yeah, so what was going on? What was the diagnosis? Not a stroke?
Not a stroke. Mr. Anger had something we call an aortic dissection, which pretty much a tear in the inner lining of the aorta. It's the biggest and the longest blood vessel in your body. And it can present in different ways. A stroke is actually one of the presenting symptoms. Aortic dissection is a medical emergency where people need to have emergency open heart surgery as soon as possible in order to save their lives, which what we did with Mr. Anger.
So once you realized what was going on, what was the next step?
So next step is to go immediately to the OR as soon as possible. And actually Mr. Anger, on his way to the operating room, he actually had a cardiac arrest where his heart stopped. And then we had to move as fast as we can and get him on a heart-lung machine and fix his aortic dissection. And then he did great. It was a long course afterwards, for sure.
I mean, looking back on that, what do you remember doctors, family members telling you?
Well, actually I was unconscious for 10 days. I was on an induced coma. And when I woke up, my wife was in the room, thankfully, and she was singing and reading scripture. And she asked me a question, and I responded. And she was quite surprised. And so, and the family was very excited because that was the first sign that I was coming out of it. And they'd been told, you know, expect the worst, but hope for the best. And it had been a long 10 days. But it was actually a few days later that my wife and son sat at the side of my bed and just kind of told me what all had happened and how serious it had been, and actually still was at that point. And I had never heard of an aortic dissection, so I was pretty shocked. But you know, Amy, I have to tell you, I had a peace through it because I knew God had kept me alive. There's a verse in Psalms that says, "My times are in thy hands." And God had preserved my life, and I just had to trust him through the difficult days ahead. It was also comforting to know I had a lot of family and friends praying for me through that time.
How wonderful. But you did spend a lot of time in the hospital. I mean, Penn State Health was your home for a while.
Yeah, I was actually in the ICU for 4 weeks.
Oh, wow.
On lots of life supports, a lot of things I didn't know the names of, and I had no idea what they were doing. But once I progressed, I moved to progressive care, and I was still having kidney dialysis 3 times a week, and still on a feeding tube and other things. And then finally moved to rehab, and I was in early March, went to the Penn State Rehab Hospital, intensive therapy for 2 weeks there. And then went home on March 18th, which was 2 months to the day from the day the event happened. And as the car was driving down the street to our driveway, here my students and faculty had all lined the street, and they were welcoming me home, which was very encouraging. So I got out with my walker, waved at them, and then went in and sat on my recliner.
Oh, that must have been such a wonderful, warm feeling to come back to. How is Tim doing now, and what is your message to viewers?
Let me say, Tim and his family have been very inspiring to me personally and a lot of people that interacted with them. He is actually doing great. He's a fighter, and as well as his family and his wife. My message to people who are listening to us is that most people with this problem have something called aortic aneurysms that they don't know about because it doesn't have symptoms. So if you have any family history of aneurysms or dissection, please get screened. It's a simple ultrasound of the heart that can pretty much rule it out. And the fact that even if someone has an aneurysm doesn't mean they need an operation. But it's good to be in a system where you get looked at by the experts and will tell you how to follow it, and if something needs to be done for it. It's much better to be fixed in an elective setting before it becomes an emergency like a dissection.
Sure. I mean, it is frightening to know that there are not symptoms for this, but it's a really, really serious thing. So I hear, it seems like more and more recently you hear, know your history, know your history, know your history, which maybe before we didn't think that much about it, but how important, if you knew you had a history at that time, I don't know if you did, but if you did, you would have probably known about this earlier.
Absolutely, you're absolutely right. Knowing the history, knowing the family history is critical, and communicating that to your primary care physician or your cardiologist to trigger them to order the right test and make the proper referral to the centers who have the expertise.
Mm-hmm.
How are you feeling?
Amy, I'm feeling back to 100%. I'm teaching full time, and I just had a lot of blood work done, and the blood work came back great. My kidney doctor was very happy with what he saw. You ask how I'm feeling. I'm feeling humbled when I think about all my family went through during those months. And I'm very grateful to God for keeping me alive. And every day I just wake up thankful for another day, grateful. And I feel very thankful to Dr. Elnagar and to really all the doctors and patient care at Penn State, because they really did a super job taking care of me. Thank you very much.
Thank you.
Appreciate it.
Gosh, if it was going to happen, I think it happened in the right place for you.
Absolutely.
Oh my gosh. Well, thank you both so much, and thank you for sharing your story.
Thank you.
Absolutely beautiful.
Thank you.
If you would like to schedule an appointment with doctors at Penn State Health Heart and Vascular